If you are pregnant or breastfeeding, you might be wondering whether it is safe for you to take the COVID-19 vaccine. Well, we have some reassuring research this afternoon from one of the biggest studies of its kind. To discuss the findings, we welcome Dr. Tamara Hunter. Hi there.
Hi, Monica.
There is increasing international evidence supporting the safety of COVID vaccines for mums and their bubs. This latest study drew data from more than 17,000 women. What does it suggest?
Well, as you said, it is one of the biggest studies of its kind, and the scientists have determined that the COVID-19 vaccines, so the Pfizer and the Moderna vaccines, are well tolerated in pregnant and breastfeeding women and also in women who are planning to fall pregnant. Although the study itself has not been completed, it does seem that the benefits of having vaccine in pregnancy or breastfeeding certainly outweigh the risks of getting COVID infection.
Tamara, you have been fielding a lot of questions about this lately. What are the main concerns that you are hearing?
Yeah, so a lot of couples are really worried about the vaccine affecting their fertility, affecting complications in pregnancy, and also affecting their future unborn child. And so this observational data of over sort of 35,000 women now shows us that those who are vaccinated don't have increased risks of pregnancy complications, birth defects, or even miscarriage. Now, although pregnancy goes for, in most cases, 9 months, the data on child health is not really there yet. There is evidence to show that there is antibody passage into the cord blood, and so some protection of newborn babies as well.
It is understandable, of course, to have questions, but people, they really should be taking their advice from health experts, right?
Look, this is a really emotionally charged space, and I can understand how challenging it is for people to be making decisions, but people need to make informed choice. And what that means is weighing up the pros and the cons and then making that personal, individualised choice. And the best space to be doing this is with research evidence that is objective and is measured and presented by someone who knows and understands medical research. And the best place to start there is with your medical practitioner who knows you.
Do pregnant women have a higher risk from COVID-19?
Yeah, there's data out of the UK of over 3,000 pregnant women that show that they are more likely to get severe infection, and what that leads to is increased rates of ICU admission, ventilation, increased rates of death of the mother and potentially of the baby as well. So it's very clear that when women get COVID and get severe infection, they get quite unwell.
Okay, so what is your take-home message to pregnant women and those planning to get pregnant?
I think the conclusion of the UK study says it best. To reduce the chances of severe infection and therefore subsequent admission to ICU, women do better if they're vaccinated compared to those who don't. And this is in a pregnant population. So vaccination is recommended.
Dr. Tamara Hunter, always appreciate your insight. Thank you very much.
Thanks, Monica.